It's not the questions that I want to ask. So the forms represent exactly what I want to ask in a particular type of setting. When I do, for example, I used to do in the past uh, CNSST. Are you familiar with CNSST? You heard of that?
Just a sec. Sit in this. Wait, are you talking the workers union stuff?
Yes, yes. So it's work-related injuries. So,
Yeah, pretty much. Yeah, that was the field that we were mostly concerned with. Meant
so
forms were difficult to handle.
right. So depending on the physicians will do all the work themselves, but depending on where they are, they would create a different form. If you work in sports medicine, then you want a sports medicine related form. So this is personalization that needs to take place. So this is, by the way, another layer of service. So the forms need to be personalized for the physician. That is one. The second thing is the coding. What do you want? I have things that I haven't shown you here, and we're gonna go quickly through what the actual form does for the doctor, and you'll see it's a lot. It's your physicians are gonna be like, what the this is possible, right? So, but the reality is that some physicians want something, some physicians want something else. And this also is a service that we sell. It's a programming service that you will be very capable of taking care of it yourself. So this is the note that we received for the patient that we filled in earlier. You see here the AI created, so this needs a little bit of a retouch as far as the prompt is made. But this is the basic thing. The first thing is the physician gets the email sent to them. They can just see, okay, this is dental caries, possible infections, most likely diagnoses. Then he mentioned irreversible pulpitis, basically possible dental abscess and a dental fracture because of the localized pain. So this layer of what I'm showing you is like the physician side. This is what the physicians need to see. The second part, our stuff is geared for telemedicine. This is something when I have a patient come into the clinic and like they already filled this up, they will sit, I will literally just read this. Just to check with you before we continue, you're a 22-year-old male with localized toothache pain in the lower right jaw area. It began on June 3rd. The symptoms, you described the intensity rated as 6 out of 10. The symptoms worsen with the consumption of cold foods and drinks and improve with Advil. You also mentioned the presence of nausea or vomiting. Which one is it? Then they'll tell me. You tried Advil as treatment, which was partially effective. And you have your smoker, your chronic conditions include smoking. You do not report any allergies to medications. Is this correct? So this is a structured question so that the patient can say, yes, no, or oh, no, it wasn't on the 3rd. It was the 4th of June, for example, because things can vary, can change. So it's the other thing. If you work in telemedicine, you go like this, copy, paste into the conversation with the physician. So this will abbreviate a lot of the back and forth. The second you get yes, that means the rest of all the information in this summary is actually going to be valid because it's the same variables. Again,
Yes.
you use
But
your
there's one problem with automating, this part, and that's a consistent problem across any field of medicine, which is that if you create a structure that is too reliant on specific guardrails, you can misdiagnose because you kind of trick yourself into thinking something is simpler or more complex than it actually is.